Hello. Do you have a case of snow blindness? You'll want to rest your eyes for a few days to let them heal. Remove contact lenses as soon as eye discomfort begins, and do not use them again until it has gone away. You'll also want to get indoors as soon as possible to avoid any further damage and avoid exposure as much as possible while healing. Do not rub your eyes. Artificial tears and cold compresses can be used to provide relief. Over-the-counter pain medications may be used as directed by medical professionals. Seek medical attention if pain is intense, there is vision loss, or symptoms do not improve on their own in 3 days. Snow blindness is like a sunburn to your eyes and can occur in a variety of settings where sunlight may reflect off light-colored surroundings, not just in the snow. Be careful when at the beach, in high altitudes, boating, welding, tanning beds, some medical equipment, or in cities if sidewalks and other pavements reflect sunlight or other UV light. Wear adequate eye protection in these environments. And until next time, avoid sun damage to your eyeballs.